How to treat cervical kyphosis with corrective chiropractic care. That's the focus of this video. If you've been told you have a cervical kyphosis, whether it's on your x-ray or maybe an MRI, talked about it, an MRI report, then this video is for you. What I'm going to show you in this video is I'm going to take you through my entire corrective care protocol that we apply for our patients to help restore a cervical kyphosis. We're going to look at the exercise that we do. We're going to look at the adjustments that we do for cervical kyphosis. We're also going to look at the traction exercise that we do in office and at home for cervical kyphosis. So stay tuned. So let me just show you in a spine model first what we're dealing with when it comes to cervical kyphosis and why it's a problem. So the normal alignment of the cervical spine or the neck should be a circular shape. It approximates the shape of a circle. Think of it like a C shape. So the face is facing that way, the back of the head's here. The neck should be a circular shape. I'll pop up an x-ray over here on the screen so you can see that, okay? And that's important because the spinal cord, which is the main connection from your brain to your entire body, is nice and loose in there. It's not being stretched or tethered. The actual joints are not being damaged or stretched. The ligaments are not being stretched. The discs are not being compressed with a normal cervical lordosis. Everything's nice and relaxed, and the neurology of the spinal cord and the integrity of the discs, the spine, the joints, the muscles are all intact and good. The problem is when there's a cervical kyphosis is that there's actually a reversal of that normal lordosis in the cervical spine. So that's what a kyphosis means. A kyphosis means bending in the forward position, okay? Now you can see that that's not good. And the consequences for cervical kyphosis is, in the long run, will cause spinal degenerative disc disease and arthritis along the spinal joints and along the discs. The discs are now being compressed in this anterior forward position, and they're not designed to take that much weight. The spinal bones are not designed to take that much weight or load in the forward position. They're designed to take most of the weight in the reversed, in the correct posterior extension position. So the cervical kyphosis not only will lead to degenerative arthritis in the long run, but it will lead to chronic neck pain. It will lead to disability related to neck pain, limited mobility, tightness in the muscles, inflammation, pain, and all sorts of symptoms that can result from affecting the spinal cord and nervous system up in this area here. So when this is detected on an x-ray, it's very important that it's corrected. And that's what this video is about. It's to show you the corrective treatment for cervical kyphosis. Hi there. For those of you that haven't met me, I'm Dr. Walter Slubra. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen, stabilize, and even correct your spine with non-surgical, non-operative corrective techniques. I'll also give you some stretches and tips on how to bend, move, and lift easier without pain and without limitation. So if you like this type of information, you want these tips and strategies, you want to learn about corrective chiropractic care, just subscribe right now by clicking on the subscribe button below, tap the notification bell. Let me know that you subscribe. Like this, I'll reply right back to you in the comments and give you a personal thank you. And like this, you won't miss out on any of this information on my channel. So I have my assistant here. His name is Sahej. He's my clinical technical assistant in my office. He helps me with all the patient setups and structural rehab that we do in our office. He's volunteered his time to be in the video, and I'm going to demonstrate these corrective protocols with him today. And the technique that I'm going to be applying today is called chiropractic biophysics. That's chiropractic biophysics, or CBP for short. I'm a trained and certified doctor in chiropractic biophysics, and I learned this technique from Dr. Deed Harrison down in Eagle, Idaho at the CBP Doctors Institute. And in the Greater Toronto region, that's where I'm from, there's only 10 chiropractors that are certified in this technique. This technique, chiropractic biophysics, is backed up by over 300 research publications. So it's a well-researched, well-established, well-validated technique for structural rehabilitation of the spine. And that's what we're going to be talking about today, is how to apply these corrective techniques, which is going to be exercise, adjustments, and traction to a cervical kyphosis, okay? So in this technique, the first thing we're going to do is we're going to exercise the spine, okay? So let's take Sahej through some of these exercises. We always teach the patient to do some warm-up exercises to get the tissues warmed up, the muscles, the ligaments, the discs, to prepare the patient for the adjustment and also for the traction session. The warmer the tissues are and the ligaments are, the more pliable the spine will be and the easier the traction will be, and the more it'll create changes on the spine. The whole goal with corrective chiropractic care is to create ligamentous changes. We want to create ligamentous creep deformation changes to restore the ligaments in the proper direction. So what that means is this. So the ligaments hold the spine together. The spine is a circular shape in the neck, just like this, from the lateral view, okay, from the side view. And the ligaments, the anterior ligaments here, the posterior longitudinal ligament on the inside, all the ligaments on the back, posterior part of the spine, they're all designed to bend in this curving shape, extending backwards, okay? So when there's a kyphosis, that original ligamentous alignment and structure got deformed in this bad position. So we literally have to retrain the spine, the ligaments, the discs, the muscles to change that, so to deform that and improve it into the better position this way. So you can imagine it's not going to be an easy process, and in most cases you're not going to get a full correction of the cervical kyphosis. So you want to reduce it and restore as much curve as possible in there, okay? So the whole point about this is to create a mirror image opposite effect. So if the cervical kyphosis is forward, you want to create a mirror image input through exercise adjustments and through traction to get that cervical curve restored into that natural lordosis as much as possible. So that's the goal with the exercises, with the adjustments, and with the traction. So you'll see everything we're gonna do, okay? Everything we're gonna do is designed to prepare the spine and also move it into this lordotic position, okay? So let's start with the first exercise. Okay, so the first exercise we're gonna do is a range of motion exercise. So the purpose of the range of motion exercise is to get the spine more mobile, get it more flexible, break down scar tissue, and it just generally feels good. It helps with pain relief. So let's start with the range of motion exercise. Step over a bit this way, and let's do side to side. So tilt your head ear to shoulder. Good, and the other way. So full lateral bending or lateral flexion, ranges of motion. We're gonna do 5 reps in all of the normal physiological ranges of motion of the cervical spine. Now, the key with this is that we always monitor our patients and make sure they're not going into any pain range, okay? If they feel pain, then we stop just before that. We do monitor them week after week, visit by visit, and we find that they are able to improve with that limit and that pain range. But in the beginning, we make sure they're moving within that range and their tolerance. Give me 5 rotations. Good. So now these are rotation mobility exercises. Again, 5 full rotations left to right. Get nice motion into the cervical spine, get all those joints moving, get the muscles activated, get scar tissue broken down, fluid imbibing into the discs, all good for the neck, okay? So these are warm-up exercises before we do any of the corrective protocols. Okay, now do flexion extension. Turn to the side. Turn over like this, good. And then forward, flexion, extension. Good, extension, and then down, good. Okay, so we're getting all 5 ranges of motion. So very important to warm up the tissues, get them activated before we do the actual corrective protocols, and especially before traction. Okay, now let's do some stretching. So do 3 on one side and then 3 on the other side, okay? So we're gonna do 3 neck stretches again to get the muscles more flexible and stretched out. We hold the stretch for 10 seconds, always within the patient's ability and tolerance. Okay, after 10 seconds, and you can do 3 to one side and pause, or you can alternate side by side, okay? Hold 10 seconds, again, give it a little rest, and then do it again 3 times total. Okay, 1 more rep each. How's it feeling? Good. Patients love this. It makes them feel really good. Totally relaxes their muscles, prepares them for their adjustment and for their traction. So those are the preliminary exercises. The next one is the prolordotic neck exerciser. So I'm just gonna grab that real quick and then I'll show you how we use this. So this is called the prolordotic neck exerciser. You may have seen it in my other videos. There's a rubber tubing with 2 handles and this spongy fulcrum point. And now we're gonna start to do the exercises to actually help induce the actual normal cervical curve. The nice thing about this is that we're going to bend and extend the cervical spine over this fulcrum point, And it'll really help to strengthen those posterior muscles in the back because we're extending back, and also stretch the anterior muscles in the front because we're stretching the front. So let's show you how we use this. And we give this to every one of our patients that needs cervical traction or cervical work, whether it's a forward head position, whether it's a military neck or a cervical kyphosis. And the direction of the actual angle and the pull, which I'll show you in a moment, will depend on the actual patient's spine and where their loss of lordosis is. So I'm going to show you one of the common ones that we see for cervical kyphosis. We're going to point it upwards, but the direction will vary from patient to patient. It is individualized, okay? So let's get into position. Turn face this way so we can see the lateral. Okay, so we're going to place it behind the neck. He's going to stretch it out first to activate it, get in front, point upward, and now he's creating a fulcrum point, and he's pulling his head into the fulcrum here, the spongy applicator here, as his hands are pulling outward away. You can actually counter pull. Okay, see how he's getting activation here? His neck is curving into the actual prolordotic neck exerciser. It's a great, great exercise. Hands up, they begin to fatigue, so make sure they're still pointing up for a kyphosis especially. Super great exercise. And we typically give our patients recommendations to do 15 repetitions, 3 sets. So a total of 45 repetitions. They may not be able to do it all at once, but they work up to it. How's that feel, Saj? Good? Yeah. And I love this exercise. It feels really good. Our patients love it. We actually give it to them as part of their package when they get their traction equipment to take home. So it can be done at home before their cervical traction, which I'll show you in a moment, and also can be done in the office before they get onto our traction equipment. Okay, that's good. Awesome. So how does that feel? Good. Yeah, it's very good. So you can see this now getting more intense, right? So we start with the mobility, get into the stretching, and then we get to the prolordotic neck exerciser. Now I want to show you one more exercise to help promote a natural lordosis in the cervical spine. I've also talked about this in my other videos, but I kind of want to package it all in one video. It's called the flip exercise, and this exercise was designed by Dr. Fedorchuk, who's a CBP chiropractor and also instructor. And the purpose of this exercise is to help promote and induce the cervical lordosis. So basically flip out of the cervical kyphosis into a cervical lordosis. So let's grab this out of here, turn to the side so they can see you, back up a bit, okay? So imagine that there's a cervical kyphosis. Imagine there's a cervical kyphosis. So that's like that, right? So we want to get the spine to flip the other way to go in this position here, okay? So cervical kyphosis, you're going to see these moves in a moment. It's going to go forward, pull it out. He's going to look up to get a curve. So he has a forward head position with a curve, and he's going to pull everything back. He's looking up to the ceiling, and then bring the head down to get more neutral and helps maintain that cervical lordosis. I've seen videos of this. I've seen x-rays, before and after x-rays, where people had a before x-ray and they're in a military neck or kyphosis, and then they went through the flip exercise, and they had a post x-ray done in the flip exercise, and you can see the actual neck curve improve in that actual flip exercise. So it's really, really effective. Okay, so 4 parts to this sequence, okay? So go ahead, part 1, forward, look up, pull back, chin down a bit. So it induces that lordosis, okay? Forward, stop, look up, stop, pull back, stop, and hold there. Okay, so it induces a nice lordosis, okay? Do a couple more on your own. Forward, look up, pull back, and tilt down just a little bit, okay? All right, so that's a great exercise. We give patients 10, 15, even 20 of these to do before their cervical traction exercise. Awesome. And sometimes they can do the flip exercise against the prolordotic neck exerciser. So demonstrate that. Put that behind your neck. Okay, stretch it out. Okay, go forward in the forward position. So now he's going forward. You look up, pull back, and then down. Okay, so he's doing the flip exercise against this as a fulcrum point as well. Very, very effective. Okay, that's good. Good, awesome. So that's the warm-up exercises. And the next thing I'm going to show you is the adjustments. I'm going to show you 2 specific adjustments to help restore the cervical curve. They're called mirror image adjustments. Why? Because, again, everything that we're doing is in the mirror image position. If the spine is like that, the mirror image is the opposite. So we're going to adjust to induce a lordosis in there. I'm going to show you a table drop adjustment, and I'm also going to show you an instrument assisted adjustment. Okay, let's get the table and the equipment set up, and we'll be right back. Okay, so in a moment, I'm going to get my assistant to lie down in the prone position, face down on the face paper. But let me demonstrate this actual table. This is a specialized drop table. that we use in chiropractic for many different types of adjustments, drop table adjustments. But in this particular case, we're going to use it as a mirror image correction adjustment for a cervical kyphosis. So this mechanism here pops up, and then when I adjust the spine, it drops below. And I can actually move this in different directions if I needed to. I could elevate it if I needed to go higher or lower. And I can also change the angulation like that. So for him, we're going to change the angulation for cervical kyphosis to induce some actual extension. So go ahead and lie down over here. So the patient will be lying down. Good. Slide up a little higher. Good. Come up over here. So I'm gonna get that neck into an extension position. Okay. Awesome. I'm gonna prop up the drop piece. Okay. And it's very gentle for the patient. Okay. Really, really gentle. I get my contact. So right inside there, and adjust just like that. Very easy. I can do 1, 2, or 3 adjustments. Get my contact. I can also get a contact like this. Very gentle, very effective, okay? So let me show you what we're doing with a spine. So here's a spine model, okay? So remember, the cervical spine is kyphotic like that, right? Okay? So we're basically applying an adjustment into the spine like that to get it to bend in this position here, okay? Sit up for a moment. Okay, so there is patients in there. The spine is kyphotic. Okay? And we're basically getting it into a extension position and adjusting into the curve. Okay? So I'll show you here. So it's kyphotic over here. We're gonna get into an extension position and we're just into the curve. Get that spine to curve back like that. Retrain those tissues to bend the spine back into that lordosis position. So that's a drop table technique that shows a corrective adjustment in the mirror image position for cervical kyphosis. Let me show you how we do this now with an instrument assisted adjustment. So one of the adjustment tools that we use in our office is called an impulse adjusting instrument. We also use an arthrostim adjusting instrument. In this case, I'll just show you this one. And there's a stylus here. There's a double prong stylus. I also have a single prong stylus, but I'll demonstrate the double prong. And there's 3 settings. Level 1, taps. Level 2 is a little stronger. And level 3, the next level of intensity of load, okay? So level 1 is what we use for the cervical spine. Again, everything we're doing is to induce that cervical lordosis, help to reverse that cervical kyphosis, okay? So on a cervical spine, hold that for a moment. So hold the bottom good, okay? So, good. So there's cervical kyphosis. I'm gonna get the neck into extension and tap, 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 tap. Just like that, okay? So that's what we're gonna do. Okay, so turn over, turn face that way, back up a bit. That's fine, perfect, yes. Set it nice and straight. So let's pretend that there's a cervical kyphosis. There's a reversal in there, right? I set up the patient, so jut your chin forward. Good, look up to the ceiling. Come back, get a nice lordosis curve in there, and tap, tap, tap. Okay? And that's a mirror image adjustment for the cervical kyphosis. How'd that feel?
Good.
Very easy and very useful for patients with cervical kyphosis. Next thing I want to show you is the traction setup. We're going to show you the home version first over here, and then we'll take you into our rehab room right across the hall, right there behind the camera, and I'll show you the actual cervical extension traction that we do in office for cervical kyphosis. So the home spinal orthotic that we give to our patients for cervical kyphosis and also for other forms of abnormal cervical alignment is the cervical Deneral. Okay, there's a medium-sized Deneral. There's also a small size and a large size. So we make sure we get the right size for the right patient. Okay. Now, everyone that watches my videos asks me, where can I get one of these? And the answer is this. This is only dispensed by prescription by a qualified practitioner that's trained on this. You have to have your spine analyzed clinically in an examination and also on x-ray. This is only given to a patient based on their x-ray findings. So you cannot go to a retail store or call in and get one shipped to you. That's just not going to happen. You need to have your spine x-rayed and evaluated and see if you're a good candidate for this. Not everyone's a good candidate for this. Someone can have a bad cervical alignment, a postural displacement of the cervical spine, even with a kyphosis possibly, and have not even be indicated for this because there could be instabilities, there can be ligament laxity, there can be hypermobility, there can be other contraindications in the cervical spine, there can be kyphosis of the thoracic spine, which this is not used for that, even if there's a neck problem, we have to address the thoracic spine first. So we can't just give this to anyone by mail or just by shopping around for it, okay? It's gotta be dispensed by a qualified practitioner. So what I'm gonna do at the end of the video, everyone always asks me, how can I find a practitioner or a doctor like myself trained in chiropractic biophysics? You just comment below. When I get to the end of the video, I'll remind you again, if you want to be referred to a corrective care chiropractor trained and certified in chiropractic biophysics, comment below in the comment section and I'll send you off a directory of trained and certified chiropractic biophysics doctors. Hopefully you can find one in your area. There's many in Canada and even more in the United States and some around the rest of the world, okay? So anyways, this is called the cervical dental and it's specifically designed with this patented peak over here to help push the cervical spine into a lordosis, okay? And this cutout here is designed to take the space of the shoulder. There's also clinical research and clinical trials that show that this is effective in improving the cervical curve. So there's actually research behind this. There are many knockoff versions of this. Those are not suitable. We don't recommend the knockoff versions. We recommend the ones by the Dental company, and this is called the cervical Dental, okay? And this is how we describe it to our patients on how to use it. So the flat part's gonna go on the floor. Now, this is done on the floor, not on the bed. I'm gonna use my table here just to demonstrate and talk to you and my assistant. Otherwise, normally it's done on the floor. So over here, we're gonna lose some distance because of the cushion on the table. Get that done, good. Okay, so right there. Okay, so this peak here is gonna go at the placement of the kyphosis, okay? And sometimes we'll even do a stress x-ray where we x-ray the patient lying on the dental to see if we get the exact effect that we want and the exact correction that we want, the exact placement that we want, okay? So in this case, we're gonna get it somewhere around the lower neck area because by the time he bends his neck over, will be exactly where the kyphosis is and help improve that curve, okay? So what it looks like on a spine model is like this. And I've had these in my other videos as well. You can look at them. So there's a kyphosis there, right? Someone's going to be lying down. Their head weight is going to cause the neck to go into extension, and the body weight will bring down their shoulders, and there'll be a 3-point bending now. The bending at the peak, the bending of the head down to the table, and the bending of the shoulders down. There's a 3-point bending, and now a nice curve is being induced in there. So that's the goal of this, is to induce a lordosis in the cervical spine to help restore the cervical lordosis and reverse the cervical kyphosis. Lots of words in there. I know it's a little technical and can be confusing, but follow along and go back and watch that part again so you understand what I'm talking about. And we're trying to create ligament creep deformation. So ligaments are stuck like this. They're deformed. We want to reverse that creep deformation into an improved position and get it to set like that. So this is going to require repetition and time. You need to do this for 20 minutes. 20 minutes is the maximum, but it cannot be less than 10 minutes. So between 10 and 20 minutes is the sweet spot. The closer to 20 minutes is better. So 15 to 20 minutes is even better. Every day, twice a day is even better, okay? And the nice thing about these home units is that they can be done not only every day, but especially on the days that the patient's not in the office, because patients will be in the office 3 times a week, but the days they're not here, they gotta be doing something at home. They can go home with the prolordotic neck exerciser and the cervical lordosis. So let's show you how we use this. Okay, Sej, so lie back. I'm gonna help guide him down. Okay, go ahead. Right there. Good. Lie back, lie down a little bit. Good. Okay, right on. And come on this side here. So you'll see here, okay? Okay, bring this arm up so they can see here. Okay? So his neck is bending over, and this over here is creating a push into his neck, causing a lordosis, okay? Now he's losing some distance here because of the cushion, all right, on the floor to give more of a push. And I do have an actual large one. Let me grab the large one right now. And I'm back with the large one. I love video editing because of that. Here's the large version. So let's replace it with the large. Lift your head up, 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 and back down. Okay, so now, okay, it feels more of a stretch there.
Yeah.
So you see he's more extended. He's a bigger fellow, right? So this is based on individual size as well, right? So bigger fellow. You can see it's nice and bending his neck. So the protocol that we do for our patients is we recommend to get to 20 minutes every day, twice a day, but start with 3 minutes and every day increase 1 to 2 minutes until they reach 20 minutes. First, you do the warm-up exercises and the prolordotic exercise before at home, and then you do the Denerol, okay? So twice a day is very important. Now, some things to look out for with the Denerol. We always give it to people where they qualify for it. If they don't qualify for it, then they don't receive it, okay? No matter what their curve looks like. We have to be proper about that and make sure we rule out any contraindications. So some discomfort will naturally be part of it, but it gets better and better and easier as the patient uses it more and more. The other thing too is there's some things to look out for that may be irritating. So there can be some numbness or tingling down the arm. If that's the case, then we want the patient to stop that and bring it to our attention, and we either modify it or stop it. There should be no dizziness and no vomiting feeling. A lot of times that's because of irritation in the proprioceptors and the vestibular response up here, and also the vagus nerve response in the upper cervical neck that can stimulate the nauseous feeling, okay? So we don't want that to happen either. If it happens and it subsides, we'll create some modifications around it, but if it persists, then we stop it. But most of the time, those reactions don't happen. They're not very typical. Most of the time people feel really good and they get used to it over time, and they really like it because it's really helping stretch their neck into that proper lordosis, okay? So that's the home Denerol, medium version, large version. Of course, there's a small version for children, younger people, and also even petite people if necessary, okay? So now let's take you to the traction room and show you the in-office cervical structural rehabilitation traction setup. Okay, welcome to one of my structural rehab rooms. This is where we do a lot of the patient exercises and set up people on the in-office traction. We have two of the universal traction systems. We have a Denerol table. Those are full spine traction equipments. Plus we have some cervical traction units in the other room as well. Okay, so I want to demonstrate this because I have more space to set up the camera. And I have Sej sitting down on the stool. And this is designed to actually cause a pull forward with the forward weight. And we're going to secure the neck back and get the patient set up to in a traction position, in a cervical extension traction position, to restore that cervical lordosis and bring it back from a cervical kyphosis. So I'm gonna go through the setup, and then as it's set up, I'll explain it to you, okay? So just follow along what I'm doing here, okay? So on here, I have 15 pounds on the front, okay? And I will move the camera so you can see this properly. So 15 pounds on the front over here, and we're gonna create this neck harness, put it against the neck, hold the bar there, Sej, okay? So get the patient to help control that for me. Now secure the neck over here, okay? So the idea is to get a weight to pull forward in that direction, create a lordosis as we're supporting the neck into a position like that to get some extension going back as well, okay? In a cervical kyphosis, you may not want too much compression back because the head position may be aligned properly with C7 and T1, but what's happening is there's a reversal in the mid neck. So usually the mid to somewhere below, so let's say C5 or C6, and sometimes C4, that general area there. So I want to pull either in slight upward pull, and we measure these angles based on the patient's necessity, based on what we find on the x-rays. And sometimes we want to go straight flat as well. And sometimes we tilt the head back in extension. Sometimes we don't, depending on what C1 is doing in relation to its normal angle, okay? So in this case, we're just going to go upward pull, slightly that direction. I'm going to release the weight. Okay, hold it. Okay, so he's still holding it. Now go ahead and let go slowly. Okay, so now the weight's going to pull forward. It's going to pull his neck forward. Okay, so see how he's being pulled forward. I got you here, go forward. Creating a lordosis in there. Now you can see the lordosis in there. And now I'm going to use this pulley here to bring the head back and hold it back into position. Okay? You okay? Mm-hmm. Good. So you can see here, nice lordosis in there. Okay? Sometimes we gotta fine tune it a bit. Good. So ear lined up with the shoulder. The neck has a lordosis that's induced. The head is mildly into extension. And again, all this is going to be based on the x-ray of the individual. This is the general idea, but the angles and the pulls and the directions of the head tilt may be different based on what the patient needs based on their x-ray evaluation. But that's a basic setup of a cervical extension traction setup that helps to reverse that cervical kyphosis, promote and induce a cervical lordosis, and helps create ligament creep deformation in the proper direction to restore that spinal alignment, okay? It opens up the spinal canal, it reduces stress on the spinal cord, It reduces stress on the spinal nerves. It expands the discs and helps to relieve the abnormal load on the anterior forward part of the discs. In the long run, once it's restored, it helps to prevent the degenerative process from accelerating. It helps to relieve pain associated with the kyphosis. Lots of benefits to this, okay? How does it feel?
Yeah.
Okay, and we have 15 pounds in the front and a small pull in the back just to create an extension of the head, and we can add more weight as the patient can tolerate it. So the protocol would be start the patient off with about 10 to 15 to 20 pounds based on their tolerance. We're going to increase every visit by 1 to 2 minutes, so 3 minutes, 5 minutes, 7 minutes, 9 minutes, and so forth. And we get them to 15 minutes inside our office. When they get to 15 minutes at their current weight of 15 pounds, then we'll drop down the time to 10 minutes and increase the weight maybe up to 20 pounds, always to patient tolerance. Then we go from 10 minutes up to 15 minutes again, and at that point, see how they're doing, and increase the weight now from 20 pounds to 25 pounds and decrease the time, and then get back to that 15 minutes again. So we want to keep increasing the actual weight according to patient tolerance, but they may not be able to tolerate the weight at the maximum amount of time every time, so we decrease the time amount as the weight is increasing. Okay, so hope that makes sense. Okay, so there's protocols involved in this and monitoring and so forth. So you can see how we can't just get someone into traction without any pre-warm-up exercises, without adjustments happening first to get everything mobilized and ready for the actual traction. Okay, doing okay? Awesome. I'm going to take them down in a moment. So that's how we apply corrective treatments. So that's how we treat cervical kyphosis with corrective chiropractic care and with chiropractic biophysics, generally in a chiropractic biophysics office and as well in our office. Hope you found that useful, and I do have more videos about cervical kyphosis right over here, so go ahead and check that out right now, and do subscribe to my channel to get more videos like this, and also get more tips and strategies, and comment below so I know what your thoughts are about this video. Go watch that video about cervical kyphosis exercises over here.